Hey, it's Medicosis Perfectionalis, where medicine makes perfect sense. Happy Valentine's Day. Today, I will ruin Valentine for you by talking about Valentine and medicine. Actually, they are intertwined, so let's get started. I've made a previous video about Christmas in medicine, so it's kind of the same thing. Words of wisdom. Did my heart love till now? Forswear its sight, for I never saw true beauty till this night. William freaking Shakespeare. And now let's talk about the story of Cupid and his arrow. Cupid is an ancient Greek mythology. And by the way, that's why the name of my channel is Medicosis Perfectionalis. Medicosis is Greek, Perfectionalis is Latin. Actually, if you read Gray's Anatomy, I mean the textbook, not the stupid show, written in like 1907, this old version, you'll see tons of Greek and Latin there. So for young Jeffrey who says, "Oh, anatomy today is so difficult," shut up, Jeffrey, you have no idea what anatomy is. But there is a huge mistake in this mythology, because actually you do not love by using your heart. Indeed, you love using your brain, specifically your amygdala, as well as your limbic system. So your brain is prosencephalon, mesencephalon, and rhombencephalon. Forebrain, midbrain, hindbrain. Forebrain is telencephalon and diencephalon. The diencephalon includes the thalamus and the hypothalamus, and here you have the limbic system. This is where true love is. So when ordinary people fall in love, they draw this like a heart and an arrow. But when true doctors do fall in love, this is how you do it, baby, through the brain. This is where true love is. No wonder why divorce rates are high. So when someone says to me, "I'm so lonely, my wife has left me," I only ask one question: where did you draw the arrow? Through the right ventricle? That's what I expected. You should have drawn it through the third ventricle, my man. The arrow in Cupid's story is an irreversible reaction because just one way. However, reversible reaction, these are the reactants and these are the products. The products will form the reactants once again. So what's the issue in the irreversible? Why didn't it come back? I'll tell you why. Because sometimes you'll have CO2 and CO2 is volatile. CO2 just disappeared. There is no CO2 to come back forming the reactants, called common sense. Back to this Roman myth. Cupid was the son of Mercury and Venus. Speaking of Mercury, actually, did you know that we used to treat syphilis using mercury? Oh, really? Yes, before the great German physician called Paul Ehrlich, not to be confused with the other Paul Ehrlich, which I've talked about in my previous video on the coronavirus. Paul Ehrlich, this one was actually a genius. He discovered silvarsan or arsphenamine. And then after that we had neo-arsphenamine, and then we treat syphilis using penicillin today, especially penicillin G, the injection, not the oral V. So for everyone who says, "Oh, antibiotics are horrible," we used to actually treat syphilis using mercury. Which one would you prefer, penicillin or mercury? I do not want any drugs. You want the tertiary syphilis, the Treponema pallidum, to eat your brain? There are no solutions in life. There are only trade-offs. If I were you, I'll take the penicillin in a heartbeat. Let's talk about mercury poisoning. Mercury poisoning, you get hypotonia, peripheral neuropathy, skin desquamation, formication, not to be confused with fornication. Haha, Valentine's Day, I'm a bad boy. Decrease catecholamine metabolism. When you decrease the metabolism, the catecholamine themselves will increase, leading to tachycardia, hypertension, and sweating. These are the same symptoms as pheochromocytoma, if you have noticed. How do you treat mercury poisoning? DMSA, D-penicillamine, and dimercaprol, the D mnemonic. And these are the words that changed my life. There are no solutions in life, only trade-offs. So, should I date this person or this person? There are no solutions in life, only trade-offs. Why am I so lonely? Speaking of silvarsan and penicillin, I have an antibiotics course on my website and it's on sale for the next 7 days. Thank you in advance. You will love this. Pharmacology is fun for the first time in human history. So who was Cupid's daddy? Mercury. Who was Cupid's mommy? Venus, the Greek goddess. Venus, you have in your human body called dimples of Venus. You see those two? Yeah, you don't see them? Okay, these two are called the dimples of Venus. The technical term is fossae lumbalis lateralis. That's why the name of my channel is Medicosis Perfectionalis. This is the lingo of science, baby. They overlie your sacroiliac joint, spinous process of L4 and 5. By the way, all of these are spinous processes, and these are L4 and L5 level. We have a test in clinical medicine called Schober's test, and you use that for forward flexion. So basically you do this. You found the dimples of Venus, like those ones, and you mark it as A. And then you go up by 10 centimeters and you add B. You go below it by just 5 and you add C. And then you ask the patient to actually bend forwards. When the patient bends in this way, the distance between B and C should increase from 15 to more than 20. Alright, this test is abnormal, i.e. positive, in patients who have ankylosing spondylitis. Because remember, in ankylosing spondylitis, you have spondylitis and you have abnormalities in your sacroiliac joints, called common sense. In ankylosing spondylitis, the distance will be less than 20. Way less than that. When someone comes and asks me, I am so single, why doesn't Cupid hit me with his arrow? I reply, please go stimulate your parasympathetic nervous system by eating a bunch of heart-shaped chocolate. This will increase your BMI and you will be a bigger target next year. Speaking of target, do not forget the target cells or the podocytes. These are poikilocytes, abnormally shaped red blood cells, and you have increased cholesterol. The cause is liver disease. The mnemonic is COD, podocyte, could stand for cholesterol deposits. Thanks to my great friend Robert of New York for this great mnemonic. Target sign. On ultrasound, if you have intussusception, specifically the ileocholic intussusception, you can see the target sign on ultrasound. The intussusception, remember, when the intussusceptum penetrates, no pun intended, through the intussuscipiens. Who named these things? Hashtag telescoping. There is another target or targetoid skin lesion, erythema multiforme, and I have a separate video on this topic. This is a lesion that involves the palms of the hands and the soles of the feet. Hey Medicosis, I'm so upset because I do not have a lover on Valentine's Day. My friend, there are people who do not have a mother on Mother's Day. This is so deep. Listen to me, my man. On Valentine's Day, please do not forget the flowers. Did you forget the flowers, John? My tactile nerve endings and Ruffini corpuscles are sensing the end of this relationship. Oh, but she told me that flowers are not that important. Ha! You're as naive as the B lymphocytes before they recognize the antigen. Call 1-800-FLOWERS. I'm kidding. Why would you get flowers? Didn't you know that you are not supposed to bring flowers to patients who are in burn units, because patients who have third-degree burn can catch Pseudomonas aeruginosa from the flower. You're not supposed to bring it to the burn unit, baby. Not just Pseudomonas aeruginosa, but Pseudomonas cepacia, Pseudomonas alcaligenes. Oh, who named these things? Alcaligenes. I would just love to enjoy a hot cup of foamy cappuccino. Well, I don't know about that, because in my book, coffee bean means sigmoid volvulus on X-ray, Neisseria species on gram stain, granulosa cell tumor on histopathology, and the coffee ground hematemesis, this is ground, this is not bean. You see this in stress-related mucosal injury when you have an ulcer, such as cases of burns, Cushing's ulcer, and trauma. Cushing ulcer is not to be confused with Cushing reflex or Cushing disease. I have a video about Cushing disease diagnosis. I have another video about Cushing triad or Cushing reflex. I just wanna cuddle by the fire. Okay, I have good news and bad news. Cuddling by the fire might increase your dopamine, oxytocin, and endorphin, specifically the oxytocin, because this is the love and bonding hormone. The bad news is you might develop CO poisoning, carbon monoxide poisoning, and your skin will be cherry red. Why? Please watch my video on carbon monoxide poisoning. And by the way, how do you treat carbon monoxide poisoning? Oxygen, 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 oxygen. oxygen mask, 100% oxygen, or even the hyperbaric oxygen chamber. We gotta kick that nasty carbon monoxide off of the hemoglobin, man. Question of the day. What are the skin lesions that involve the palms of the hands and the soles of the feet? Since this is Valentine and I really love you guys, endocrinology playlist will start in 2020. Yes, indeed. As long as I'm inspiring and expiring, you will see endocrinology in 2020. Please help me by sharing. And in less than 2 weeks, coming to my website, the Cardiac Pharmacology series, baby. It's gonna be amazing. We'll talk about antihypertensives, antiarrhythmics, diuretics, digoxin, cilostazol, dipyridamol, melrinone, emrinone, alirocumab, evolucumab, etc., and so on and so forth. So please subscribe and hit the bell because when I release my cardiac pharmacology series, I'll have discounts and they will not be available for a long time. Follow me on all of these platforms. Please support my channel on Patreon or PayPal. This is my email. This is my website. Do not forget to get the Antibiotics Course because it's on sale for 7 days. Thank you so much for watching. As always, be safe, stay happy, and study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.